Welcome back to another episode of Weathering Parenthood. I'm your host, Lauren Oleski, and we are here with Dr. Leah Roberts, and I have to say it really, really slowly because my brain doesn't work because I have 2 children now, a reproductive endocrinologist, right? I said it right?
You said it right.
It's like I used to not be able to say meteorologist or meteorological very quickly, but now it kind of rolls off the tongue. So reproductive endocrinologist, I have to think about it a little harder. Okay, so what does that mean? Tell people what you do.
Essentially, it means that I'm an expert on women's hormones, and mostly I focus on infertility.
You make little babies in a petri dish.
Exactly. Exactly. Yeah.
Pretty cool job.
I mean, I think I have the best job in the universe.
You're helping build families, which is awesome and just sounds wonderful.
It is wonderful. I have the best patients. I have the best team. I really love what I do.
That's awesome. So tell people a little bit about how you got into this, your several years of schooling that you had to go into.
Absolutely. So like a lot of people, I went to the University of Florida, go Gators, for my undergraduate degree in biology and my minor in English. Then I went to 4 years of medical school at Florida Atlantic University.
Okay, so that's 4 years plus 4 years. That's 8, right, so far.
8 years so far.
We're not done.
Then after you graduate with your medical degree, you are a physician, you are a doctor, but you continue with additional training in residency. So I went to Temple in Philadelphia for 4 additional years doing general training in obstetrics and gynecology.
That's 12 years. 4 plus 4 plus 4 is 12. So much schooling. Continue.
So at that point, I was able to deliver babies, do hysterectomies and other GYN surgeries, etc. And I did practice as a generalist for a year. Then I followed that up with doing a fellowship in infertility for an additional 3 years.
So 15 years, right? Is that
15 years? Yeah.
That's a lot of schooling.
It is a lot of schooling, but it has been completely worth it.
That's awesome. And she's an expert now. So I want to talk a little bit about infertility and the concept of conception for people, because it can be incredibly, incredibly stressful. I have 2 children of my own. You have a toddler. You have another one on the way. We're going to talk about her experience with bringing, number 2 into the world shortly.
Which has been an experience, let me tell you.
Sure. You might all think, oh my God, she looks so good for being 7 months.
7 months pregnant.
Right.
But it's not my uterus.
Right. We're going to talk about, that's tease. We call that a tease. We're going to talk about that shortly. But conception can be incredibly stressful for women. So I feel like sometimes we get in our heads in terms of thinking about, oh my God, I have to do this, take these tests for my fertility and things like that. But at what point does someone actually need to seek out a specialist if they've been, trying for too long or more than they would like to?
Absolutely. So human beings are not very efficient at reproduction. That's why we have 12 periods a year. Okay. So we know your average chance when you're at your most fertile of getting pregnant in any given month is only about 22%.
Okay.
So as we age, our ovaries have less quantity of eggs and as well as less quality of eggs. So to a certain extent, that is going to dictate what we need to do. So if you have at any age been trying for more than a year, so 12 menstrual cycles, we do recommend you coming to see us just to make sure that all the parts and pieces are working correctly. Additionally, if you're 35 or older, we recommend trying after 6 months to get in to see us, because at that point, your likelihood of conception on your own has just dropped so much. And once you're 40, as soon as you're starting to think of conceiving, we generally say to come in and get a checkup right away. Now, that being said, if you don't have a regular menstrual cycle or really you have any concerns whatsoever, it's never too early to come and see us, because we can always do a checkup, give you a clean bill of health, and let you go on and conceive on your own. Just coming in doesn't mean that you're going to use IVF or anything else like that.
Right. It's just to check a little insurance policy if you're questioning your fertility or your hormones at all.
Exactly. And if you don't have regular menstrual cycles, you are not going to be able to conceive, because if you're not ovulating, that egg and sperm can't meet. So really, if you have any questions about your menstrual cycle, that's a good time to come see us.
So during the conception process, a woman, let's say she's just seeing her OB, before she decides to maybe come to a specialist such as yourself, what are the types of questions you think women should be asking their OBs when it comes to, family planning?
Absolutely. So when you're thinking about family planning, it's really important to bring your OB into the conversation because she can help you, or he can help you maximize your health. You want to make sure you're taking a prenatal vitamin. You want to get your dental work done before you conceive, because as anyone who's been pregnant knows, your gums are going to bleed a ton during pregnancy. You want to get your sleep cycle under control. There's all sorts of things you can do to kind of optimize yourself for pregnancy. Additionally, you want to talk about what your long-term goals are. We don't want to just worry about getting pregnant for your first time. We want to think about your complete family.
Right.
if you want one child, that's very different than somebody who wants 5 children, and how quickly and how aggressively we need to be. There is some blood tests that can be done to make sure you're in tip-top shape, but not all of it is necessary, and it really depends on your specific situation. One of the things that I do recommend for everyone who's trying to conceive, however, which is not always standard, is to get genetic testing done for recessive diseases. So those are diseases you have to get from both mom and dad. And so we recommend all of our couples to get that testing because maybe nobody in your family has ever had cystic fibrosis, but that gene can be carried down through the line. And if you and your partner both have that gene, you could end up with a really sick kid. So we do recommend that testing for everyone before they try to conceive.
Interesting. So let's say they're with their OB, they've been trying for 6 months to a year, depending on their age, and they come to see you or they come to see another reproductive endocrinologist. What can people expect their first time? I can imagine it being very scary and maybe a little overwhelming. What is it like when someone enters, you or another reproductive endocrinologist's office?
Well, the first thing after you sign in is we're going to get a set of vital signs for you, okay? Then once you come in, we're going to go through your complete medical and surgical history, what medications you take, some very detailed questions about your menstrual period, about your sex life, okay? Expect to be talking about your sex life. I know that can be really uncomfortable in the doctor's office.
So if your mom comes with you,
yes,
she's going to hear about it.
She's going to hear about it. And I have tons of moms who come in with their daughters, and I think that's fantastic, but you're going to be talking about your sex life. Then we talk about a little bit about natural fertility, about all the parts and pieces needed and all the diagnostic testing to be done. So when you want to conceive, we need you to have eggs that are ovulating efficiently. We need to have normal sperm, and we need to have a uterus and fallopian tubes that are working correctly. So we kind of go through each of those different compartments, as we say. So testing that is then ordered on that date might not be completed on that date. Usually that first visit, though, you will have a transvaginal ultrasound. Doesn't matter what day of your cycle you're on. And then we'll order the rest of your testing that is often date dependent of where you are in your menstrual cycle.
So you mentioned, we'll do different testing. You'll have a sperm analysis too. So it's not necessarily just the women that you're looking at. You're also looking at, their partners, because sometimes it can be, male infertility, or they can have an impact on it.
So about a third of the time, it is just the sperm. And an additional 20 to 30% of the time, it's a combination of both things that we need to optimize. So at least 50 to 60% of the time, the man is part of the problem. And I know there's a lot of resistance to getting a semen analysis, but of all the things that you guys are doing that is so invasive, the man can give us a sample to look at under a microscope. It's not that bad.
Right. We're getting probed and prodded and, blood tests and things like that. I've had friends that have had to go through IVF. And in certain cases, it was, the man and the sperm that wasn't optimal.
And just because your menstrual cycles aren't normal doesn't mean there isn't also something going on. A lot of times it's multiple different compartments at play.
Right. So lots of things can be happening, and, you do your best to kind of get all of that in check for everybody. So they come to see you and you decide together with your patients, maybe this is something that we need to move forward with. We need to do either IUI or IVF, depending on what they're, a best candidate for. How do you make that decision, or how does a couple make that decision?
Absolutely. So there are some things that you absolutely are pointed one direction or another. You don't have fallopian tubes for some reason. You've had ectopic pregnancies, the fallopian tubes have been taken out. Really, that's what IVF was designed for people with fallopian tube issues. Or there's a genetic reason, right? So you're a carrier for BRCA, or you're both carriers for cystic fibrosis. Those are reasons to really push for IVF. But for most people, it kind of, the world is your oyster, and we want to see, based on your specific parameters, what your best use of resources are. So are there tons of sperm and tons of eggs, but we just need to be more efficient at getting those eggs to ovulate? You might be a great candidate for IUI. Are there less sperm, maybe something we need to optimize? That might be a better candidate for IVF. And we can really see, based on all of the diagnostic testing, which direction we want to go. Now, additionally, based on your specific egg quantity and your age, we can put you into calculators to see, okay, it would take this many IUIs to equal one IVF cycle, etc.
Interesting.
Also, if you want to have 5 kids, IVF might be the better way to proceed, because even if you have lots and lots of eggs now, you may not later.
Right.
So we can freeze your future fertility.
That's cool. Science is interesting, right? It's amazing what you're able to do with the technology that we have nowadays. I want to talk about the timing that we're doing this podcast. We just came out of Endometriosis Awareness Month. We're soon going into National Infertility Awareness Week. I want to talk about those two things because I feel like they're I don't want to use the word issues, but they're diagnoses that women get, and they're either not spoken about enough, they're not diagnosed correctly. Someone has these problems, they can't figure it out, what's wrong. Let's talk about both of those two things. Let's start with endometriosis. What is it? How does someone get diagnosed with it?
Absolutely. So endometriosis affects about 10% of women. And it's when the endometrial tissue, which is the lining of your uterus, is somewhere outside in your pelvis or in the rest of your body. So instead of having the endometriotic tissue inside your uterus, it's on your fallopian tubes, it's on your ovary, it's on your diaphragm, it's in your lungs. And when you bleed every month, you can have significant pain because the blood isn't supposed to be in the rest of the pelvis. The blood is supposed to be inside the uterus. So this is something that can take a long time to diagnose because women's pain is often ignored. Especially teenagers. They want to, the thought is, oh, they're just trying to get out of school. They're trying to get out of PE, etc. And it can take 8 to 10 years or more to get a diagnosis. And if it's not diagnosed, you can actually make it significantly worse because A, you're not getting the treatment you need, and B, you're growing more and more of those implants in various places in your pelvis. It can definitely contribute to infertility because it can affect your fallopian tubes, it can affect your ovaries, it can affect your ovarian reserve, but additionally, it can really, really affect quality of life, everyday quality of life for women for, a couple or more days a month. Women's pain is often ignored. And something as simple as taking a birth control pill or taking a high-dose NSAID starting 24 to 48 hours before you expect your period can really, really change their quality of life. So it's so important to get the word out. And really, your high school freshman who is having debilitating pain should be given, the respect of that pain and just not ignored.
Right. They're not just trying to get out of gym class or something.
Exactly.
They're in pain and they need to have something looked at.
Exactly.
Thunderstorms that are hanging out mostly off the
As a
coast
meteorologist, I
this
can't
morning.
always control the weather. And as parents, we can't always control our kids. But we can make sure our outfits aren't a total disaster. That's why I'm excited to partner with Mario Pucci, South Florida's destination for timeless, stylish clothing that fits every chapter of life. They can get you out of the leggings and out of the house. Whether you're headed into the office, out to dinner, or to the carpool pickup line, Mario Pucci has you covered. Plus, when you look great, parenting somehow feels easier. Visit Mario Pucci in Regency Park, Boca Raton today.
So from a diagnostic standpoint, most of the time we can make a presumptive diagnosis based on history, the physical. It's often not well seen on imaging. Very specialized centers will do hour-long ultrasounds and have pretty good diagnosis. But the gold standard for diagnosis is really direct visualization and biopsy. So that requires putting a camera in through the belly button and looking at the pelvis and getting samples, which really isn't necessary for the majority of cases, because if you're having all the symptoms, if you're vomiting every period, if you're having diarrhea, severe pain, all of this stuff, we can just treat you for it. We don't necessarily have to have the actual tissue saying, oh, this is it.
Right. Interesting. Okay. So if someone is, at their OB and they're having all of these issues, maybe they're at an OB that is like, it's normal to have pain or you're fine, because that can happen sometimes.
Oh, yeah.
What should they do?
Say, I'm really concerned that I have endometriosis. What do you think about? And then, if you're not trying to conceive, birth control can really be a great way to control endometriosis. Or, what do you think about one of these other treatments? Because OBs are really well trained in this. And if you push back a little bit, you definitely can get the treatment you need.
That's great. So now I want to talk about, we're coming up to National Infertility Awareness Week. Again, this is at the time of this recording. Talk to us about that. I feel like infertility is a really difficult conversation to have. It's hard for, people to discuss. You're not sure how to be there for your friends. So let's start with the week as a whole and what it is.
Absolutely. So National Infertility Awareness Week really is to bring awareness to the issue because, historically we knew about 1 in 10 women, or 1 in 10 couples, were affected by infertility, but now it's actually decreased to about 1 in 6. That's for multiple reasons. One is people are waiting longer to start childbearing, but there's also seems to be, different things in our environment that are changing our fertility nationally, internationally. Sperm counts are going down. There's more hormonal issues going on. But kind of like for a long time, miscarriage wasn't really talked about.
Right.
Infertility isn't talked about because it can be a little embarrassing. You need to use donor sperms. You're as a woman, your body is supposed to just do this, and it's
not working.
It's not working, and also it's kind of involved with sex, and sex is such a taboo topic in a lot of families. So we really just want to bring awareness to this issue so that people can look around and say, I'm not the only one. You know, in the average kindergarten class, there's a whole bunch of IVF babies running around these days. If it's 1 in 6 couples, the average kindergarten class has 4 or 5 IVF or IUI babies. So on Wednesday, we wear orange for infertility. And the whole week, there'll be all sorts of different events talking about infertility awareness so that, you know, even if you are not ready to talk about your own journey, most people know somebody who has suffered from this.
So let's say you do know someone that has gone through it or is going through IVF or IUI or whatever it is. How do you talk to them about it? Or how do you be there as a friend? Are there, you know, I feel like it's kind of such a taboo topic. You know, I'm not even sure what questions to ask you about it, let alone like, how do you talk to a friend about it? How do you be there for them?
You know, it's hard. They want to feel like a normal human being. So anything that you would do for them if they were going through any other difficulty is appropriate. Take them to lunch, go get their nails done. If they want to talk about it, don't get awkward about it. But don't bring it up either. Like if they're going through a retrieval cycle, don't be like, oh, how many eggs did you get? How many embryos did you get? Because if they want to share, they'll share it with you. But if they start talking about it, ask questions and don't be toxically positive. Like, oh, just stop stressing and you'll get pregnant. That's the worst.
I hear that all the time. Just relax. It'll happen naturally. Yeah. Sometimes it's out of your control.
Sometimes, well, most of the time it is out of your control. And, you know, give them some grace. Let's say you're having a baby shower. If they don't want to come, you know, don't give them a hard time. If you're going to announce a pregnancy, you know, and you know they're suffering from infertility, maybe tell them a little bit beforehand. Don't wait until they're in front of 20 of your best friends, you know, over margaritas to tell them that you're pregnant. Maybe pull them aside before and just be sensitive to it, just like you would be for anything else.
Yeah. So I want to go back to now your patients, they come in, that's what they, you know, their first visit, you ask questions, you do a full workup, things like that. Let's say they're going to now start the process of IVF. There's lots of shots, lots of injections, a little bit of chemistry going on in their own home. What are they going through for people that are curious about, you know, the different medications that you're doing, the shots that you're taking?
Absolutely. So in doing IVF, what we're trying to do is take eggs that would have been discarded that menstrual cycle and grow them for us to use. So we're never touching their bank vault for the rest of their life. We're just collecting more of what would have been used that normal menstrual cycle. And essentially what we do is we give the same chemical that the brain makes to make you create one egg to ovulate, which is FSH, follicle stimulating hormone, and you're taking shots of that. So they'll take 1 to 3 shots depending on their protocol for about 8 to 12 days. Okay, so what does that mean? They're taking shots in their abdomen. Most people give it to themselves. And they're little insulin needles. Okay, so it's not that bad. People do quite well. And then they're coming to our office every couple days. So maybe 4 to 6 visits of ultrasound blood work. So they're going to look like a IV drug user with big bruises on their elbow, intercubital fossa. And when on average the follicles are ready, which we'll see on blood work and ultrasound, they take a shot to trigger ovulation. Because the timing of this is so important because we want to pick up those eggs right before they would ovulate into her abdomen. Then they come in for their egg retrieval. They get anesthesia with a physician anesthesiologist, an IV in their arm. It's basically like a colonoscopy where they're breathing on their own, but they get a nice nap. It's the best nap of their life. We do a transvaginal ultrasound, put a little teeny needle in because when you're laying flat, your ovaries are sitting right by the edge of your vagina. Put this much needle in, take out all the eggs. And that's it.
And
then we take the sperm, fertilize, grow an embryo, etc. But all that is happening in the lab. They have the rest of the next week or two to rest, recover, get those ovaries to shrink back down to normal size, drink a lot of water.
And then from there,
transfer. So once we have an embryo in our hands, most of the time now we do frozen embryo transfers because your hormones are so out of whack from doing an egg retrieval because each of those eggs make estrogen. If we get 10 eggs, it's 10 times the estrogen of a normal menstrual cycle. And then additionally, if someone wants to do genetic testing for a number of chromosomes, we have to wait for that to occur. So then we prepare the endometrial lining, whether it's using their natural menstrual cycle or estrogen and progesterone, to put an embryo back in a procedure that's like a pap smear. It's a pap smear with full bladder under ultrasound guidance, but really the embryo transfer is no more than that.
That's good.
Yeah, it's fun. So that's my favorite thing to do.
So something interesting about what you do and the process of going through IVF is that you have to go through IVF yourself. Remember that tease we discussed at the beginning of the episode? So you're having a second child, but like you mentioned, not in your uterus. Talk about, your first pregnancy and what led you to then having a surrogate.
So when we talked about diagnostics a little bit, remember I said we need egg, sperm, and uterus.
Right.
But those things can be separated from each other.
Right.
So essentially we used my egg, my husband's sperm, and our wonderful angel of a gestational carrier's uterus to carry the pregnancy. Now, my pregnancy with my firstborn was unfortunately very, very complicated. I was in the hospital for over a month. I had IVs the entire pregnancy. And although he's perfect, we didn't know that that was going to be the case. I was very, very sick. I had something called hyperemesis, where I threw up 10 to 20 times a day.
To like the millionth degree.
Yeah, it was awful.
Right.
So he's worth it. But we knew having another child using my body was not going to be possible.
Right.
Because I almost died in my pregnancy. We didn't know if he was going to make it. And we didn't want to put another child through that risk.
Right.
So
Or yourself.
Or myself. Or be away from my current living child
Right.
for that period of time. Or my patients for that period of time.
Right.
So essentially we made embryos. And then we put them back in my gestational carrier. But I myself did go through 2 rounds of IVF to make enough embryos to be able to do this.
So you're able to relate to your patients a little bit more. So if they're
Unfortunately, it's much better being the doc than the patient.
Right.
That being said, each round was 2 weeks of my life. It was emotional. And lots of hormones, but it was very doable. I wasn't that uncomfortable.
Right.
And now I can kind of tell people what to expect. Okay, this day, the day after your retrieval, you're going to be so cranky. Okay, go to the spa that day.
right.
Don't work next to your husband that day. Like he will annoy you. His breathing will be really loud. His chewing, his typing. So it's nice to have gone through it from that perspective. I also did 2 very different protocols, so I can talk people through giving the different shots because I've given every shot you could possibly give to my son.
Right.
Which is nice from a counseling perspective, not so nice from a living through it perspective.
I'm sure. So as of this recording again, so your carrier is how far along?
She is 31 weeks and 0 days pregnant.
Ooh.
So we are having a baby in about 8 or 9 weeks.
The countdown is on.
Oh yeah.
So
I'm
exciting.
terrified.
It's gonna be great. It's gonna be great. So tell us about I like to ask this question to people. We talked about it on my first episode. It was a solo episode I did where I polled everybody about their expectations before they had a child versus after. What was something that not that you weren't expecting, but like you thought something would go one way and it was just like completely different when your son was born, your oldest?
Yeah. So one thing that I was really surprised at is like my husband's pretty easygoing. We've been together 17 years. We've been married over a decade. And I didn't think that he would have such opinions on specific things like on baby-led weaning or, just little things that suddenly my husband, who doesn't care about anything, has really strong opinions on, like
Right.
what method we're going to use to potty train or those kinds of things, which I was really surprised at that.
It means he cares.
I mean, it's nice that he cares, but also I want to do it my way.
Right.
I've read all the books. I've listened to
Right.
all the podcasts. How many podcasts
You
has
brought
he
us
listened
those
to?
worlds.
Yeah. Did he grow this man
You
for
have
9 months?
dibs.
Yeah. But it's nice to know that he cares, and it's nice that he has opinions on things. But that surprised me because I just kind of thought that like I was going to run the ship.
Right. I think that's like something that like women go through. It's like you get to see your husband now becoming a father. What kind of father are they going to be? And, he's got opinions on food and sleep.
Yeah, like how many pieces I cut my grapes into. Like, is 4 pieces enough? Do we have to cut into 8 pieces? My husband is a big 8-piece. He really likes to
Does
cut
the
them
grape
small.
cutter thing?
Yes, I do love the grape cutter
Does
thing.
that do 8 pieces?
Or maybe it does 4 pieces, and regardless, he is in charge of grape cutting
Grapes
because
are a touch of
I will just bite it in half and hand it to my son, and apparently that is not the appropriate way to do it.
I mean, I'm the same way. I would just like bite it and give it to mine. So what are you most looking forward to with number 2 on the way? There could be multiple things. What are you most excited about, or what are a few things that you're excited about?
So I'm really excited to see how my son is going to interact with her. He is so excited for this baby. He is so excited to have a little sister. He keeps on saying like, oh, when I'm a big brother, I'm going to drive the car. When I'm a big brother, I can eat cookies or whatever it is. So he's really excited about that. And then just seeing this baby grow up with her cousins. My son has a really, really close relationship with his cousins. My husband does with his cousins as well. And so it's really nice to kind of raise them all together.
That's awesome. Nice big family unit.
Exactly.
Thunderstorms that are hanging out mostly off the
As a
coast
meteorologist, I
this
can't
morning.
always control the weather. And as parents, we can't always control our kids. But we can make sure our outfits aren't a total disaster. That's why I'm excited to partner with Mario Pucci, South Florida's destination for timeless, stylish clothing that fits every chapter of life. They can get you out of the leggings and out of the house. Whether you're headed into the office, out to dinner, or to the carpool pickup line, Mario Pucci has you covered. Plus, when you look great, parenting somehow feels easier. Visit Mario Pucci in Regency Park, Boca Raton today.
So I'm going to talk about now, I'm going back to the surrogacy side of things. How has it been for you to not carry your child this time around? Is it like, oh, yeah, I don't have to be pregnant? Is there a little bit of a, oh, I kind of miss that? What has that been like for you mentally?
I think it's really hard because you are trusting someone else to basically extreme babysit for 9 months.
Right.
My gestational carrier is an angel with a halo. She's amazing. I could not ask for someone better, but at the same time, like, I have to trust,
right?
What if she gets in a car accident, or, what if she eats something bad or whatever else? And she's very careful, but, not feeling those kicks every day. Like, I had my little belly buddy for 9 months, and
right.
As sick as I was, to a certain extent, it does feel a little detached. I'm the dad.
You are the dad.
I'm the dad. It's great that I can drink or do whatever else.
Right.
But it's hard. Yeah. I know it's the best choice, but it gets emotional. Yeah.
That makes sense.
She's not hearing my voice all the time.
Right. She's got to put it on speakerphone.
We have a little recording. It's like this little, like, special earphones that go on her belly.
Oh, that's so cute. So just of you and your husband's voices.
Yes, and my and Seth. Yeah, my sons as well.
That's really cute.
Yeah, it's fun.
Any pets? Do you let the pets talk or meow or bark?
No, we have not put the cat on because I just didn't even think about that till this moment. But when I was pregnant with my son, the cat did lay on my belly a lot and purr. So maybe we should have done something like that.
Maybe you can
record some purring.
Make it angry. Let it meow at you, and then that she'll know, like, oh, there's also a cat in the family, not just a loud little toddler.
The cat is obsessed with the baby's room. Has been sleeping on the rocker, making everything smell like him. So yeah, we'll see. There'll be buds. He loves my first.
He's like, oh, there's going to be a calm lady in the house. And not like a
crazy, insane toddler.
Yeah. Well, boys are a different breed, man.
Oh, yeah.
Both of mine are boys, and I'm waiting for the second one's 5 months. So we've got some time till he's like, a not so toddler. But number one, man, he is quite a boy and he is quite a toddler. I want to talk a little bit more about your experience as a mom. This podcast is about parenthood and motherhood and just kind of relating to other moms. What has it been like raising your son for the past almost 3 years? I believe he's almost 3.
He's almost 3.
What's that been like? Your life before, your life now, and now you're having another one come into the family. What are you most looking forward to for yourself when you have, number 2?
The smell.
The baby smells the best.
Baby smell. I love the baby smell. I think that women have been raised to think that they can have it all, and we really have to embrace our village. My dad is super helpful. He's like the third parent. I couldn't do it without him, being an OBGYN, being an REI. I am up and out early in the morning.
Right.
And my dad comes and gets my son up and gets him fed and gets him to school. And I wouldn't be able to do that without it. And I think that a lot of working moms put so much pressure on themselves, even if they have the best husband in the world, which I have the best husband in the world, keeping track of birthday gifts and holidays and schedules, like, it just naturally falls to mom. And, the school is always going to call me first. And no matter how many times my husband says to have him call, I'm the one that gets called for boo-boos or anything else. And so there's a lot of pressure.
Yeah. It's a lot. Moms can't handle a lot. A lot of big mental load for us too.
It's a huge mental load. And, there's this idea, I think, in a lot of men. It's like, oh, I'll help out if you tell me what to do. Well, making you a list is adding another thing to my mental load. Like, figure it out yourself. You're an adult.
Just do it. You should know. You know what size clothing I like to think they wear. You know what size diapers. Just order the diapers. One time I got, hey, we're out of diapers. Okay. You know what size he wears? Place the order.
Yeah. Mm-hmm.
Yeah. If you're listening, men, help out your wife.
Order the diapers.
Just order them. Hey, honey, look, I got more diapers. They came in. I noticed we were running low. You know how amazing that is?
Yeah.
It's the best. All right. So I like to do this too with my guests. A rose and a thorn from this week. What's like something that beat you? We'll start with the thorn. What's something that like beat you up motherhood wise this week? And I'll share mine next because I definitely have them. Or I'll go first.
Go first.
I have a 5-month-old. He doesn't sleep through the night still. If you're out there and you're watching and your kid is over 5 months, or you're like you have a 12-week-old and it doesn't sleep through the night, it's not supposed to. Mine still doesn't. I feel like that's all I've been speaking about on this podcast because that's like the biggest expectation, I think, for me that I've like had is like, oh, they'll just like sleep eventually. I had friends whose kids were sleeping through the night at 6-8 weeks. Not mine. My first, he's 3.5. He still wakes up at like the crack of dawn. Is it daytime? Is it daytime yet? I'm like, no. He goes, no, I see there's a little bit of light outside. I'm like, it's 6 a.m. Can you go back to sleep? And my 5.5, almost 5.5 month old, it'll be, 6 months soon. He still wakes up once or twice a night, and that's okay. It's normal. Don't forget about it.
Normal. My first did not sleep through the night once until he was 11 months.
There you go.
That I am not looking forward to. Sleep deprivation.
Well, hey, maybe she'll be a sleeper. You don't know.
From your mouth, Scott's ears.
You never know. The cat will purr, and we'll get her to
And
sleep.
she'll sleep. That would be great. And you know what? If she doesn't, I survived.
Exactly.
If I can survive OB residency with sleep deprivation, the first year of life is nothing.
So my thorn this week is our lack of sleep. Have you thought of?
So my thorn is we traveled across several time zones recently, and my son is having a hard time adjusting, and so he hasn't been sleeping very well, and he's been exhausted, and we're waking him up to try to get him on the schedule. And I picked him up from school, and he goes, "Mommy, I did not have a good day."
Aww.
And I was like, "Baby boy, what happened?" And he goes, "I did not have my listening ears on." And he had so internalized that. And it just broke my heart. And I know that he's going to have because he was tired. Like, I know he's going to have some hard days sometimes. And you can't save your children from that. You can't wrap them in bubble wrap. Like, they need to have a bad day sometimes. But like, it just broke my heart.
Oh, that's so sweet.
So we went and got milkshakes.
Good for you.
You guys, I just felt really bad because we set him up for that. Like, there's no way to not set him up for that when we're doing that kind of traveling. But it made me really sad.
It's hard. But
I had a hard day with the time zone change too.
Right. I think everyone would if they were traveling multiple time zones. But now, hey, you could like take him to Europe and he'll be prepared to change time zones.
Exactly.
You know what I mean?
Oh yeah, that sounds like a great idea.
Right. Just do it. It could be fun. Okay. So my rose for this week is that my littlest one rolled over for the first time. So it's very exciting. I was like in the kitchen and I turned around. I'm like, oh, you're on your belly now. We're learning. So that was our most positive that happened this week.
Okay. My rose is a work rose.
Okay.
I have a patient that I've been working with for over a year. She's just had a very complicated course. It's really difficult. And we finally got a positive pregnancy test.
That's amazing.
And she's the one that 2:00 in the morning, I'm waking up and thinking about what else can I do? What can I do differently? And so to be like, yes, we're pregnant. And granted, we got to get through the pregnancy, but it just is such a good feeling.
That's amazing. What a rewarding job you have.
So wonderful. Yeah. But when people don't get pregnant, it's hard because I know how important my son is to me. Mm-hmm. And now that I have kids, the stakes are that much higher of if I don't get you pregnant, I know what you're missing in your life.
Right. Because I'm sure it must have been different when you were in, residency and your fellowship before you had your son. You maybe were not detached, but
it's different. It's just different. Yeah. It's more esoteric rather than something that's really tangible.
Yeah. That's interesting. Okay. So I know you make really interesting social media posts.
Oh, thank you. I try.
They're so informative about different, you share your own journey of IVF on there and the different tests you're going to be taking or just random subjects about random things. And you also make really fun videos with your partner.
Yes, my partner, Dr. Margolis, is amazing. We always, we have fun.
So where can people find you on social media if they're interested in contacting you, which you don't just work in the South Florida area, people from out of state do telehealth with you too.
Absolutely. So I do telehealth anywhere in the United States and people just will come down for their retrieval. You can do a lot of your monitoring remote, but my Instagram, just for some more information, education, something fun, is Dr. Roberts and Fertility on Instagram. So DrRoberts.
And then
fertility. Fertility? I'll have to double check that.
Just look it up. You'll find it.
I think it's Dr. Roberts Fertility. I think I said infertility.
And then because again, mom brain. So that's what we're working with this podcast. 2 children. My brain doesn't work. I'm thinking of questions sometimes. Sometimes most of them are written down. Some of them aren't. I'm thinking of more. What should people look for when shopping around for an IVF specialist? You got to shop around sometimes for a mental health care, physician. You might not be everyone's cup of tea. What's, when people are looking for, a doctor that's going to best fit their needs, it's okay to look,
Absolutely.
more than one.
So One thing that I really, really emphasize is you want to find someone that you can have a therapeutic relationship with.
Okay.
You want to find someone that you jibe with because this is so emotional. Okay. You want to find someone that you really feel is listening and hears you and that you really connect with. And most importantly is their office. Okay. You want to be able to talk to a human being. You want to feel supported by their nursing staff, by the rest of their staff. You want to make sure they have an amazing embryology lab. Doesn't matter what I do. If the embryology lab sucks,
Right.
it's not helpful at all. I'm actually also trained as an embryologist, so I did that in my former life as well, spent time in the lab. And I can tell you the difference between a lab that's well run and a lab that is not really, really can change your outcome. So you want to make sure someone has a really good lab. You want to make sure they have a great support staff and a great support team. That can be the nurses, the MAs, their nurse practitioners or PAs, their embryologists. And at the end of the day, you'll just feel when you're in the right place.
Right. And I mean, you might not be for everyone either.
No, absolutely. Absolutely not. Each physician in our office has a little bit of a different flavor and each office has a little bit of a different flavor. Where I trained, we did 10,000 cycles a year. We had one of the best labs in the world. But there were 22 different doctors, and finding the right person, the right fit is so, so important to having a good outcome.
Yeah.
And a good experience.
It's a very emotional time. You want to make sure that you have someone that you like and you trust and, is there until you quote unquote graduate.
Yes. The number of baby showers that I have gone to that are babies that I've created is really special.
That's very cool.
Yeah.
So Dr. Leah Roberts, thank you so much for joining us today. Thank you all for listening,
having me,
or watching. Follow us on all of our social channels. We'll have it posted at the bottom of this episode. And thanks for joining us, and we'll see you next week.